Today we're talking about men don't like kids. Ugly fact number 2. Family members support alcohol and drug addiction. Woo! Now that gets a person's attention. What do you mean we support alcohol and drug addiction when we really are trying to support recovery? Well, the chapter has 3 takeaways, like every other chapter in the book. Number 1, about 1 in 10 Americans ages 12 and older is addicted to alcohol or drugs. So every family has at least one drug or alcohol addict. Number 2, family members often unwittingly support alcohol and drug addiction, thinking they are supporting recovery. And then number 3, treatment for alcohol and drug addiction works. Let me say that again. Treatment for alcohol and drug addiction works, but the process of recovery is slow and painful and very deliberate. Family members have an important role in the recovery process, but it is to support recovery and not addiction. So it should come to no surprise for most Americans that most families are going to have a drug addict or alcoholic. And because alcoholism accounts for over 70% of addiction, most families are going to have at least one alcoholic in the family. And the toll that the alcoholic typically takes on the family is very negative. And that can be the immediate family, as well as the extended family, as well as loved ones. And so typically, a family will adapt to the addict or alcoholic irresponsible behavior. And by that adaptation, we mean that family members will do all kinds of things to help addicts to avoid the negative consequences of their irresponsible behavior that comes from their preoccupation with being drug seeking or alcohol seeking and drug exposed or drug taking and alcohol drinking most of the time. And there are, of course, what we call functional addicts and functional alcoholics, but that is not really a real thing, because even those functional addicts and alcoholics take away something very important from their family structure. They end up not doing all of their responsibilities and requiring those adjustments so that the family can minimize its negative consequences from the addict's behavior or the alcoholic's behavior. Unfortunately, helping the addict or alcoholic with their responsibilities or not giving them responsibilities at all simply helps to feed their addiction. I'll say that again. Helping the addict or the alcoholic with their responsibilities, either with the responsibilities or to avoid the negative consequences of the responsibilities, only feeds the addiction. And that can be very painful when family members are trying to be helpful and or when family members are trying to ensure the functioning of the family system. So the chapter talks about how addiction treatment actually works. It goes step by step regarding the treatment process and regarding the change process, so that family members and loved ones of alcoholics and addicts can make sure that they are working to assist the addicts or alcoholic in their recovery and not in their addiction.